So may I call our next speaker, of course, the one and only, the legendary Professor Inass Shaltout, the woman of the hour and every hour. So her lecture is going to be titled Obesity and Women. The floor is yours, Professor Inass.
Too much compliment, Professor Muhammad, maybe because we are like brothers and sisters. I'm going to talk about women and obesity. This is my favorite topic, and obesity is rapidly unfolding healthcare crisis. We are having more than 800 million persons living with obesity, and expected in 2025 to have 1 billion adults living with obesity. And when we look to our area, Egypt, we're having obesity with a prevalence of more than 30% of obese people in Egypt, in Libya, in Saudi Arabia, Gulf. The twin epidemic of obesity and type 2 diabetes are on the rise. From 1986 to year 2000, the prevalence of BMI 30 is doubled. BMI more than 40 quadrupled, and extreme obesity with BMI more than 50 is increased fivefold. This is alarming. Increasing prevalence of obesity among children leads to continuation of the problem later on in adulthood. In the morbidly obese population, average life expectancy is reduced 9 years in females and 12 years in males. We are living in an obesogenic environment due to urbanization, sedentary lifestyle, less physical activity, high caloric and fat intake, and women are more likely to be overweight or obese due to cultural norms and perceptions. This is the lifestyle of Egyptians. The percentage of people who eat 5 or more combined servings of vegetables and fruits per day, only 20% of Egyptian males or females. And for physical activity, this is the percentage of people who do not do any physical activity at all. We can find that 57% of females do not do any physical activity at all. And for the prevalence of obesity in males, 21% compared to 39% in females, and overweight 60% in males and 72% in females. According to different international associations, the World Obesity Federation, American Medical Association, Royal College of Physicians, Obesity in Canada, European Association for the Study of Obesity, and Asian Association for the Study of Obesity, all these associations consider obesity as a disease and a health issue and needs urgent interference. These are the complications of obesity, and obesity is associated with multiple comorbidities, metabolic, mechanical, and mental complications. And metabolic complications include many complications like asthma, NAFLD, gallstones, infertility or subfertility, hypogonadism, polycystic ovary syndrome, pregnancy complications, certain cancers, CVD, and other risk factors for CVD like stroke, dyslipidemia, hypertension, coronary artery disease, coronary heart failure, pulmonary embolism, and type 2 diabetes, thrombosis, and gout. Another group of complications, which is the mechanical complications affecting joints, also incontinence, sleep apnea, and chronic back pain. The psychological and mental complications include depression and anxiety. The clear and present danger, increased incidence of arrhythmia and sudden death, and for every 10% increase in weight will lead to increased 6 millimeter mercury blood pressure, and any decrease in body weight will lead to decreased blood pressure, respiratory sleep apnea, impaired respiratory function, and Pickwickian syndrome. And this is a picture of Mr. Pickwickian, which is a character in the novelist Charles Dickens. He was given this character as an obese person who sleeps while sitting down, and later on it's called Pickwickian syndrome. And this is another picture of obstructive sleep apnea, which is a serious complication. Hepatobiliary, fatty liver, calcular cholecystitis, arthritis, especially of weight-bearing joints, certain cancers, diabetes mellitus, and this is a relation between BMI and chronic diseases in males and females. We can find increased incidence of type 2 diabetes followed by cholecystitis, hypertension, and coronary heart disease. And this is a relationship between BMIs and the risk of type 2 diabetes, and we can find in females above BMI 35, they have 93 times increased risk of type 2 diabetes than those with BMI less than 22. And this relation was not visualized in males in this magnitude. Males are 42 times increased when BMI is above 35 compared to those with BMI less than 22. These are some other complications of obesity, physical complications like feeling tired all the time, breathlessness, varicose veins, headache, edema, cellulitis, sweating, intertigo, and stress incontinence, and social complications like sense of isolation, unemployment, family or marital stresses, financial stresses, and we said depression. Life expectancy decreases when BMI increase. Life expectancy is reduced 3 years in those with BMI between 30 and 35, and in those with BMI between 40 and 50, life expectancy is reduced 8 to 10 years. And for each 5 kilogram per meter square higher BMI, we have 40% higher mortality rate for ischemic heart disease, stroke, and other vascular diseases. Now we talk about abdominal obesity and CMR. Abdominal obesity increased the risk of cardiovascular disease, and this was visualized in the HOPE study. Abdominal obesity increased the risk of developing type 2 diabetes. Abdominal obesity predicts sudden death in the Paris prospective study, and abdominal obesity increased the risk of coronary heart disease in this study. And women and obesity, it's more than an issue of size. We need to change the priority physicians give to obese women. There is greater health consequences, greater psychological consequences, and special or specific female issues like fertility problems, polycystic ovary syndrome, pregnancy complications, influence on fetal development, complications related to menopause, and female cancers. Obesity affects women disproportionately. In an obesogenic environment, women are at a greater risk of developing obesity, especially severe obesity when compared to males. Female obesity, a life cycle of medical risk starting from early childhood till geriatric times, and from adolescence to adulthood, obesity can cause psychological disorders and some reproductive health abnormalities. Fertility with assisted reproduction is reduced in obese ladies, and fertility with assisted reproduction is halved for obese women when compared to normal weight women. Body mass index predicts infertility in women with or without polycystic ovary in this study, and miscarriage rate increases after IVF in those with BMI more than 30 versus normal BMI, and live births decreased, or the rate decreases after IVF in those with BMI more than 30 versus those with normal BMI. During pregnancy, many complications can happen in obese mothers. This is a meta-analysis of publications from 2008 to 2021. Increased incidence of all obesity complications during pregnancy, like miscarriage, gestational diabetes, preeclampsia, antepartum depression, macrosomia, large for gestational age, stillbirths, congenital heart disease, spina bifida, preterm birth, failure of labor, cesarean delivery, post-term birth, postpartum complications, hemorrhage, and postpartum infection and depression. This is the complications during pregnancy, and we have medical complications and technical complications due to difficult ultrasound. And in early pregnancy, medical complications include miscarriage and twinning. And in the antenatal period, we have pregnancy-induced hypertension, preeclampsia, gestational diabetes, and venous thromboembolism. Intrapartum, higher rate for induction of labor, planned and acute cesarean section, assisted delivery, and vaginal tear. And operative complications, higher rate of cesarean section, infection, bleeding, and thrombosis, and anesthesia hazards. Postpartum, hemorrhage, infection, and venous thromboembolism. And fetal complications in the form of macrosomia, congenital anomalies, fetal distress, perinatal morbidity and mortality, and birth injuries. Gestational diabetes can happen in 4% of all pregnancies, and overweight women have 17% risk of gestational diabetes. From metabolic effects during pregnancy to effect on the offspring. The offspring can have childhood obesity, type 2 diabetes in the future, hypertension, and renal complications in the future. This is the implications of obesity for mature and aging women. Increased risk of obesity is related to many comorbidities with aging, like type 2 diabetes, hypertension, cardiovascular disease, and increased risk of almost all types of cancers. And we're going to screen cancer relationship with obesity. And the most common cancer in obese female is uterine cancer, followed by cervical and breast. This is a special female cancers, but cancer kidney can be increased, pancreas, esophagus, gallbladder cancer. All these types of cancers are increased in obese females. Obesity in the older woman, there is increased risk of cognitive dysfunction and dementia with aging, and negative implication for life expectancy. And this study showed that the risk of Alzheimer's disease in elderly women with metabolic syndrome versus without metabolic syndrome, dementia, Alzheimer's dementia was increased in females with metabolic syndrome versus those without metabolic syndrome, and this association was not noticed in males with or without metabolic syndrome. Obesity is an independent risk factor for Alzheimer's disease, and obesity is associated with increased risk of dementia, and longitudinal study showed that overweight and obesity was associated with temporal lobe brain atrophy in CT scan. Then it's a life cycle of complications, starting from early childhood till later on in life and till the geriatric time. It's possible to reduce weight, and this lovely Egyptian celebrity before and after weight loss, another Arabic celebrity also before and after weight loss, and these are the beneficial effects of body weight reduction. Many metabolic and mechanical complications can be corrected and improved by just losing weight. Thank you very much.
Thank you very much, Professor Inass, for this elegant lecture, as usual, about obesity in ladies, especially coming from a brilliant professor and a wonderful lady. Thank you very much, Professor Inass.